Hi, everyone. My name is James Powell. I'm with DocLoop. We are a revolutionary platform for healthcare providers that makes easier workflow for both the patient as well as the clinician. And I appreciate you taking the time for this presentation today on your genomic blueprint. I'm going to spend a few minutes talking about genomic testing and how very valuable genomic testing is in enhancing your clinical outcomes and also mitigating or dramatically lowering your risk factors for things that you have a genetic predisposition for. Why does genetics matter in today's care? First of all, many of the health conditions, including virtually all of them that most people have mortality from, these conditions develop quietly over many, many years before symptoms appear. Sometimes when I say many years, we're talking about 10 years, 15 years, many, many years or decades before a symptom would manifest. The whole idea is prevention here. Don't wait to get sick or have some kind of disease process and then try to react to it. In many cases, it's too late, or there's limitations in treatment or the prognosis, when the truth is that could have been completely prevented in many cases. Standard lab work that you have done shows what's going on with you right now. Genetics show what you are predisposed to. If you know anything about genes, we get genes passed down from both parents. You can be heterozygous, homozygous with certain things, one copy, two copy, if you will, and that can increase in some cases 50%, 100%, 2, 3, 4, 500%. In some cases, it can increase your risk factor for a major disease process, again, including the ones that people die from in many cases. It can increase that chance by well over 1,000%. The good news is, if you know that now, many times, most of the times, these things can be prevented. When your doctor or clinician understands your genetics, recommendations can be more precise. That's what we call precision medicine. We can be more proactive. I've been on my own longevity program as a patient for almost 20 years as of this recording. I've done quite well. I have no doubt the health status that I've achieved in avoiding medications and things is a direct reflection of my program. However, the most valuable thing I've ever done in my own program and with my own health was having this genetic test done. It certainly enhanced my protocols. Smart refinements were made, and no doubt, like so many other patients we've treated over the years with genetic tests, it's going to make a big difference in me lowering my risk factors for some things that we all have predisposed to. In my case, cancers and cardiovascular disease, and a parent dying from Alzheimer's, like so many of you. And again, we're trying to be proactive here and mitigate these things and dramatically lower your risk factors. What your genomic test can reveal: all types of things. Again, from cancer risk, cardiovascular risk, neurocognitive decline. It can tell us how your body processes nutrients. It can completely change your nutrient protocol, your supplement protocol. Some people have problems metabolizing certain types of vitamins or different things. You need to know that if that's the case. Otherwise, you're taking things for no reason. In fact, genomics are now helping guide cancer treatment. It can tell physicians, even oncologists, if you had cancer, how your body's metabolizing certain types of chemotherapy drugs. I mean, it's really, truly one of the most profoundly valuable things in medicine in recent decades is knowing a person's genetic profile. It can tell us about your inflammation in your body. It can tell you how your body detoxifies different things, all types of metabolic tendencies, your hormones, how your body processes hormones, how your body would be impacted even if you got on hormone replacement therapy, which some of you are, your neurotransmitter pathways, your genetic risk patterns tied to aging and chronic disease. And again, I've said this a couple of times already, but we can take virtually every one of the top common causes of death in this country. And we know that there are some major things you could be doing if you knew your genetic profile in either mitigating or substantially lowering your risk factor for common causes of mortality. Your genes don't predict your future, but they certainly help us make better decisions in your clinical protocols. I'll tell you right now that in my training over the years, and I've helped train in various ways in longevity medicine, well over 1,000, probably a couple of thousand physicians and nurse practitioners and PAs and various types of practitioners in preventive medicine, uh, all types of anti-aging medicine, longevity medicine, whatever you want to call it. And with genetics, they can be very complex. That's one thing when I talk to physicians in recent years about doing genetic testing, and they've ever really looked into it. Some of these reports can be not only time consuming, but quite complex. They don't really make them user friendly for a layperson like yourself. Not at all. Not really, don't even make it that user friendly in many cases for physicians. They can be complex and hard to understand, or hard to take the reports from these tests and take what you need from the test and apply it to personalized recommendations. That can be again, very complex and at the very minimum time consuming. It may not really prioritize or explain in the right context what is applicable to you as a patient and what we would need to put in place, whether it's exercise and nutrition recommendations, whether it's some kind of prescription or hormone medication, whether it's uh, supplementation, all of those things that will be very important for you to get the outcomes that you're wanting for, that you're coming into that program for. So patients in many cases, along with clinicians, are left unsure of what actually matters. So how do we turn complex genetics into clear, precise guidance? Well, DocLoop is a healthcare platform. It's AI-powered platform. It is fully integrated in all aspects of longevity practices. What it does, and I'll talk about the actual process of genetics and genomic testing here in just a minute, but it can manage all the testing, the analysis, the clinical protocols, even automate all the follow-up. So everything is done from your end and the clinician's end very precisely, very concise, and very efficient. The results, and by the way, there's all types of genomic testing out there. I've had one done in the past years and years ago. It was very inexpensive. Quite frankly, they don't tell you much. I know there's different vendors out there offering it. I really think they're a waste of effort, waste of money by what they give you as far as translatable to you enacting in a protocol. But if you get one of the real, and there's different vendors out there, we use the most sophisticated and most advanced genomic testing labs, first of all. And the reports that even we get initially can be 100 pages, 80, 90, 100 pages. I'm telling you right now, if you tried to read one of these 100-page reports, it would be like reading Greek. And it's not much better for your physician who's had training in genomics. So what we do is we take, in our platform, we take that complex 80, 90, 100-page report, and we also give them a simplified, concise version, a Cliff Notes version, if you will. This easy to understand. It's easy for them to be able to put together the right structured, precise program for you. It is even easy for you as a layperson to understand. It's very patient friendly and an easy to understand language. The recommendations are aligned with your clinician's judgment also. It's aligned with any other testing they've done with you, whether it's normal lab work, whether they've gotten an H&P on you, whether they've done some body scans, body scan analysis. They know clearly what your goals are, what you came into a program for. They take all of that information, and with genomic testing, it aligns with that and can no doubt get you better outcomes by knowing the genetic predisposition. So how does the process work to get started with this? Well, your clinician can order the kit. It's a swab kit. They can order that directly through the DocLoop platform. The kit is shipped directly to you. It's a simple at-home swab in your cheek. You'll get the results back. We'll get the results back in about 4 weeks. So it's a very simple, straightforward process, easy to get started, all tracked. You get tracking on this. It's all tracked through the platform. We'll set up the appointment with you through the platform. You'll get notifications on this. Your clinician, when we set up this call, your clinician reviews the results. The genetics will help inform about everything in your program, whether you're on a program already or about to start a program with that physician or clinician. Again, in my case, I was already on a good nutrition program, but I'm telling you right now, when I found out what I was genetically predisposed to, it helped refine even how I eat. We did not have to reinvent the wheel with me. I was already doing a great job with my clinician, but there's no doubt that knowing my genomics made some very smart, very minor modifications, which is in fact helping my long-term prognosis as far as reducing risk factors for what my genomic profile said. Minor tweaks in exercise, few minor tweaks in nutrition, and definitely changed a couple of things. In fact, there are some very specific genomic supplements based on genomic profiles that are evidence-based. There's been a lot of research on it. I think it's made a profound difference in my current health status as well as my future by knowing this and modifying my supplement regimen accordingly. In some cases, it would tell us if you have a 1,200% greater chance of having a certain major disease, and you even have that in your family history, maybe you even have some of the small red flags in your current lab work, I think we can all agree we would want to know that. And that can make a difference in some cases, even with prescriptions for medications. Recommendations ultimately are very personalized to you. It's not a one size fits all. And when we get the results back, we do something pretty unique. I know of at least one group maybe that might do this, but it's very, very rare. We'll set up a three-way phone call with you, your physician or your practitioner, and a PhD in pharmacy, a PharmD. They've had 8 years of training. They have PhDs in pharmacy, and they've had specialized, rigorous training in genomics. They know a lot more about genomics than I do. They know a lot more than your clinician. I don't care how well trained they are in genomics. They're experts in the field. They actually train doctors in the field, as a matter of fact. And they will get on that three-way phone call, go through your results. As I said before, they'll take that 80 to 100-page report. They'll even give you a Cliff Notes version with clearly defined interventions and things you need to understand first. You will, and you'll be able to enact in your program exactly what you should be doing, whether it's lifestyle modification or specific supplements or prescriptions or hormone therapy, whatever it may be. They'll explain it. They'll answer your questions. Your clinician will interject what they need for you to understand based on any of the tests they've done with you. You'll know exactly what the plan is, what the next steps are. And with your clinician using the DocLoop platform, everything can be ordered right there in the same platform. We can get this done in seconds. You'll get tracking. We can get everything shipped out. Your follow-ups will be done through the platform. Again, it's very user-friendly. It's much more efficient workflows and follow-ups. You'll be in the loop, and you'll get the outcomes that you came in for. Again, everything in one place, one platform, every workflow. You get appropriate reminders, the platform, even with your doctor's input, your clinician's input. You'll get educational materials. Everything is supported along the way. We believe that not only your clinician, we've always believed that patients, if they know what they're supposed to do, what they're supposed to be on, the rationale behind it, questions answered, you're educated, you're truly in tune with your body, your needs, your genetics, your lifestyle, everything. You'll be much more compliant. You'll get much better clinical outcomes. What do patients commonly experience from this? Certainly more personalized recommendations, much better understanding of your personal risk. By the way, when I think about family history sometimes, the real question in family history, because doctors always ask your family history, was anyone in your family treated for high cholesterol, let's say? Well, just because it's in your family history does not necessarily make it in your genomics, your genetics. Sometimes it's how your family lived, how they ate, for example. If they had a historically very poor diet, then maybe they had certain disease processes. It was based on their lifestyle more than their genetics in that case. Or it could be one or the other, it could be both. So you really need to know your genomic profile, not just what your family had, siblings, parents, grandparents had. We always believe in a clear rationale behind clinical care decisions, giving you a greater confidence in the long-term planning. It really puts everything in the right perspective and adds context to all of your health decisions. Again, clear, clinician guided interpretation, personalized recommendations rooted in your biology, a lot less trial and error. Again, we could do basic testing and basic labs on anyone and get you started in the right direction on your health journey. You'll always be better off if you have certain supplements, if current labs show some deficiencies in, if you eat in a certain way, eat healthier versus not eating healthy, doing exercise versus none. There's no doubt that has benefits, but if you really want to achieve the highest level of clinical outcomes and the highest level of lowering risk factors for future disease processes, there's no better test ever created than knowing your genomic profile. I really think every patient should have this type of genomic test if you can. That way we can have you on the right precision medicine program that is well structured and well supported. When we talk about genomic testing, we always talk about the 3 Ps: predict, prepare, and prevent. We can predict what you're predisposed for. We can predict it with your genomics. We know what your risk factors are for all the common diseases that people die from. As long as we can predict it, guess what? We can now prepare. I've said this a few times. We can mitigate these risk factors. We can substantially lower your risk factors for these future diseases. We can prepare properly for these and put together a precision clinical plan for you. And therefore, in most cases, we can prevent them from happening. So what's your next step here? Discuss your genomic testing with your clinician. Someone sent this to you, your physician, your clinician in your program, or a program you're thinking about. Contact them, discuss the next steps, how to get started, the cost, get this kit shipped out to you, decide if this approach aligns with your health goals you have, the health goals maybe you've already discussed with them, and begin when you're ready. Thank you for taking the time for this. And again, please contact the clinician that sent out this presentation to you.